Hello, my guest today is Nancy Dickey. Dr. Dickey was the first woman ever to be elected president of the American Medical Association. She is the recipient of numerous awards, including both 6 honorary doctorates in degrees such as science and law. Nancy serves on numerous committees, both locally and nationally, and writes for several medical and health policy journals, as well as being a frequent speaker at professional and civic organizations around the country and world. Dr. Dickey currently serves as a professor in the Department, of Primary Care Medicine at Texas A&M Health Science Center. She also carries the title President Emeritus at the Health Science Center, having served the role of president for over a decade before stepping out of the administration and into teaching and policy development. Whew, that was a lot. So welcome, Dr. Dickey.
Thank you very much, Kacie. I'm delighted to be here.
You are absolutely, clearly a very accomplished woman. Can you start off by telling us what inspired you to become such a leader in healthcare?
I think it just happened that I got some exposure and discovered I really enjoyed at least the policy perspectives of it. I went to medical school, married my college sweetheart, so we were married all the way through medical school, and was really assuming that I just wanted to finish my training and go hang my shingle and practice medicine. But one of my colleagues, the training after medical school is called residency. One of my colleagues in residency was very involved with organizations that do health policy, the AMA and the Academy of Family Physicians. And the AMA had been much less open to having students and residents participate in their process. The Academy of Family Physicians had always welcomed students, and Gene had been very involved in that. So he came back one day in the middle of my first year of training and said, we've just won a huge battle. The AMA is going to let us elect students and residents to each of their policymaking bodies. And I said, I have a 6-month-old baby. I'm in my last phase of training. I've got everything I'm looking for. And he said, I need two people's names on the ballot for 8 different positions. It's a free trip to San Francisco. Well, medical school and training are usually poorly paid times. You're usually paying other people. And so I thought, I can let him put my name on it, get a free trip to San Francisco, enjoy the city, come home. He's happy, I'm happy, right? Except that the other fella, whose name I don't remember, whose name was on the ballot I was running against for this position, didn't show up. And so I left San Francisco elected to a policymaking body for the American Medical Association. And it was like opening a whole new world. 40 years ago, we didn't learn a lot of health policy. I think we do a better job in medical school today. But things have been changing very rapidly in medicine, certainly the science and technology, but also the policies about how we practice and how we get paid and how we organize ourselves. And 2 years on that council, and I was hooked. And so it just became my golf game, if you will.
I love it. That's so interesting. It's the kind of the side of medicine, I guess, that I never think about. Sort of on the flip side, what kind of hardships and struggles did you encounter on your journey to becoming president of the American Medical Association?
Well, there were not a lot of women in medicine or in the AMA at the time. And certainly there were some people, not a lot. I mean, by the time you get to the national level, these are pretty thoughtful people. So there were some people who would have comments to make. When I was following that first election, I was elected to the Ethics Council of the AMA, which was a very small group, a group of very senior men. And, I can remember being told that they were concerned that their entire process was going to change. After all, they were used to sitting around in a group of a half a dozen with their cigars and their ribald stories. And now they were going to have a young woman in that mix. So I think there was probably more anxiety than there was actual discrimination or pushback. And I became very close friends with all 5 of those gentlemen. I can remember when I was first elected to the AMA board. Again, the chair of the board was a person who'd supported me through most of my, at that point, elections and appointments to get to that position. And I was elected, and then a year or 2 years later, a second woman was elected. So as she came in the door, I went back to greet her and tell her how delighted I was that there was going to be another woman on the board. And he crossed his arms at the front of the room and tried to be very stern and said, "How many of these seats do you women want?" Now I knew Jack well enough. I was pretty sure he was being funny, but I'm sure it was also very threatening in some ways. I mean, here was a whole new group of people they had to compete against. Our answer, of course, was, how many seats are there? We want them all. And I had some wonderful mentors that perhaps helped me avoid some of the traps. I had a mentor who said, if you think you want to continue past just being a board member, you've got to be on the finance committee. In fact, ultimately, you've got to chair the finance committee, because you need to be sure that all those men out there know you understand the workings. What allows the AMA to continue to exist, of course, is you got to have enough money to pay the help and do the publishing and all that kind of stuff. And the 5 years I chaired the finance committee have paid off for me over and over and over, well beyond the AMA. So I think it was more an occasional individual here or there. It was certainly things that you don't read about in the discrimination literature. How do you work the social interactions? These were all men. They were mostly men who were 15 to 20 years older than I was, and their spouses, their wives, spent all day together, usually planning dinner that night. Okay. My husband was at home with our children. He had a career of his own. And so did I try to put together my own dinners? I learned that was the best answer. You could just hide away and do room service, but this is a very social organization. I mean, politics is a social game. And this is medical politics at its highest. So you had to get out of the room service and go do some things. But then you also had to be concerned if you were going to hook up with the men whose wives weren't there, then they had some fears and concerns that people would begin to talk. Okay, Nancy and John, Nancy and Bob, Nancy and somebody went to dinner. So it was usually a group dinner. Okay. And I learned that I should set up a couple of dinners before I ever went to meetings, so that I wasn't trying to do the work of the meeting and scramble around and figure out what I was going to do for dinner. And as time went on, of course, I became good friends with many of the spouses as well. But, you know, we tend to do things in pairs in our society. Mm-hmm. So it's little things like that. When you get ready for the big annual meeting where you induct the new president, it was always a black tie affair. Okay. Well, that's pretty easy for the guys. You put on your black tux, right? What am I supposed to wear? It was kind of a black and white picture up there, and nobody ever said to me, you can't wear a cherry red dress. Now, 25 years later, there are women in purple and red and green, and you know, which is wonderful. But it's little things. Who else do you ask? I mean, the guys are all going to wear their tux. So I can't say that I felt that there was substantial discrimination. There were occasional times where you had to say that that's inappropriate, or I choose not to respond to that, or whatever it happens to be. But those were very individual and certainly not organizational.
Well, it sounds like you really took any challenge that you met and, tackled it head on. I gotta admire that. That's awesome.
Oh, my father once told me the way to get me to do something is tell me I can't.
There you go. There you go. I love that. That's honestly so inspiring. And sort of speaking of that, I understand that more women these days are attending medical school than men, excuse me. What do you attribute to that change? And with more women becoming doctors, how do you feel it will advance the practice specifically of women's health?
Well, we are sitting right at 50%, so 50, 51, 52. But there are people who think that will continue to grow, and that a substantial majority may become women. Now, there's some interesting thoughts about that, and then I'll return to your second half of the question about how it will impact health. But many years ago, one of the things I got to do as president of the AMA was be part of the World Medical Association. And one of my colleagues from Scandinavia, I think it was from Finland, asked me if I'd read the recent article about pink colorization. I said, no, missed that one. Well, it was an excellent article about what happens when women enter a field. Now, you can go as far back as the 1800s, when most secretaries, of course, were men, literate men, and they got paid relatively well because they kept everything in the office moving along. As women moved into secretarial positions, it not only became a less highly respected position, but it became a much more poorly paid position. His data suggested the same thing would happen in medicine, that as women came into practicing medicine, that the specialties in which they practiced would have less respect, be considered less demanding, and they would get paid less well. And in fact, the same wage gap that exists for women across the United States exists in healthcare. And it, I hear people tell me all the time, well, they take more days off, they see fewer patients. No, any way you slice it and dice it, whether it's by the patient, by the hour, by the procedure, women get paid less. Now, maybe that's because we're willing to accept less. Maybe we aren't good negotiators. Maybe we think that we're getting paid well enough. But it is a powerful message that our society believes that they can pay women less to do the same or better work than the guys are. I do think that the data shows some very positive things. Women tend to bring a little more relationship. Now, keep in mind, we're making vast generalizations. So there are fabulous male physicians out there who are extraordinarily good at relationship with patients. But in general, if you lined up all the women, all the men, women get a few more kudos for bedside manner, for relationship with patients, for bringing the emotions of healthcare to the bedside. They have, I don't think there's any specialty left that doesn't have at least a moderate number of women in that specialty. So they've proven that they are capable of doing everything from orthopedics and neurosurgery to pediatrics and OB. It is kind of interesting, as you would probably expect. One of the areas that's gotten truly a majority, an overwhelming majority of women is OB-GYN, women's health. And men are now complaining that, in fact, they're discriminated against. They can't get into the training programs because women patients would prefer to see a woman physician. And so a training program wants to train the people that their patients want to see.
Right.
And so it's kind of, I feel bad for guys who really want to enter that field, but I want to say to them, welcome to our world. Right. We have to push back a little bit. I think all in all, there are going to be very small differences that you see because women come, but there's little doubt that if you have experienced something, you bring something different to the table. I worked my way through college as a nurse's aide, and I had an older nurse say to me, you can never be a good nurse, and I took that to mean or a good physician, if you haven't had major surgery and had a baby. Man, that lets out about 70% of the doctors out there. So, and so, if you've been pregnant, if you've had infertility, if you probably can bring something to the table that a male physician can't. And to the degree that you incorporate that sensitivity into your practice, I think that's not only valuable, but the great researchers are likely, many, many researchers will tell you, I came into this area of research because I had a niece, a cousin, myself, somebody. And so having women who have a vested interest in understanding either a disease process or a physiologic process makes sense that they may, in fact, put a little more energy behind the solutions.
Absolutely. That makes total sense to me. My next question is, I think I know the answer to it. But during your own journey as a female physician, at any point, did you ever think about giving up? Judging from what you said before, I think you, again, sort of tackle obstacles pretty head on. But if this did happen, if you did ever feel like giving up, how did you overcome this?
Well, if I ever did, and I'm sure I must have at times, out of just sheer fatigue,
Yeah.
please, I just want to go back to bed. It was pretty short-lived. I mean, I was born to a father who was a farmer, and my mother ultimately we moved to California and then to Texas, and so she worked in an office. They had high school education, so as this extraordinary opportunity, a lifetime of opportunities opened up to me, I just continually had to think, wow, I mean, little girl off the farm in South Dakota, it's amazing. So the fun, the challenge, the excitement, the people you met, the issues you got to deal with, I think far overcame the frustrations. There were certainly occasional personality issues. There was lots of fatigue. I was married, had 3 children. My golf game being politics, occupied a ridiculous amount of my time, and I was in private practice up until the year before I became the chairman of the board of the AMA. So yeah, we were juggling a number of things, but no, I think life is more fun if you take on the challenges, and if you don't overshoot the mark too much, so that you want to succeed more than you fail. I think that keeps you getting up in the morning. But yeah, everybody has those days they think, why in the world am I doing this?
I like that. I think that is very inspiring. Again, very empowering to hear. It's a very good mindset too. Just sort of looking at the positives and like where you came from and what there's left to do. If you could do anything over again, what would it be and why? And now this question is sort of a two-parter again. Do you have any advice for young women who are thinking about becoming leaders in healthcare, either, as administrators or as, doctors and medical professionals that way? So another two-parter.
Is there anything I would do differently? I'm not sure there really is. I have great respect and admiration for women who seem to be a little better at deciding they want to do many of the same things I've done or that others have done, but they're gonna kind of sequence it out a little bit instead of doing all of it at one time, and that makes sense to me. When I was making decisions about what to do, whether I was going to do a particular thing or not, it felt to me like it was usually a once in a lifetime opportunity. That if I said, no, I'll come back and knock on my door in 10 years and see if I'm more ready for this, that odds were good nobody was going to come back and knock on my door. And so no, I'd probably just do what I did. I would say to women, though, many of whom have decided they want to do a variety of things. And one of the things I heard often when I was in administration over at the Health Science Center in the College of Medicine was the number of women who went into medicine because medicine had become a little less of an all-consuming profession, that their fathers often had said to them, I would have discouraged you from going into medicine, but now you can go into medicine and work part-time. Now you can go into medicine and do shift work. Now you can, okay. But I also run into a fair number of women who decide that they now have 1, 2, or 3 children and they're going to be a soccer mom for a while. And I would strongly urge men and women, but women in particular, to think very carefully if they do that. Again, the rapidity with which the science of medicine is changing and the increasing emphasis that we have on safety and competence and so forth means that if you step out of clinical medicine for more than 18 to 24 months, you may very well pay a price for that. One of the things we do here at the institute I run is physician assessment and retraining for people who have been out of medicine, out of clinical medicine, and now they've decided they want to go back. It may be that they were sick, or it may be that they stepped out voluntarily and they wanted to be with their young children. It may be that a family member was sick and they had to take all of it. So sometimes it's preventable, sometimes it's not. But after 3, 4, 5 years, you can't simply go back and say, okay, I'm back. I want to see patients today. So, you want to find a way, if possible, to perhaps cut down the amount of time you're spending, but stay clinically active so that you don't have to face this assessment and retraining process that you might face if you step out of medicine. As we were looking at what the magic time was, we thought 3 years, 4 years, 5 years. We spent some time with the Surgeon General of the Army Air Force, I think. And they said that as they were sending pediatricians over, you can imagine a pediatrician here, even if you're in the Air Force, okay, then getting sent over to active duty in Afghanistan. You're not doing office pediatrics over there. You're not seeing kids in immunizations. And they said as little as 6 months. And when those pediatricians came back home, they would have them in a paired practice someplace to kind of regain the thought processes that went into it. So it may not be 3, 4, 5 years. It may be 18 months to 2 years. And I think medicine will only become more challenging in terms of having to prove that you have kept up with the changes that are occurring in whatever your specialty happens to be. So that's one thing I would caution women. A personal statement, certainly no data to prove it, but we tend to want to stay home when those babies are small and cuddly and so forth. And they say, I got to be with my new baby. I will tell you, those new babies will let you pick them up and hug them and love them any time of the day that you're home. They just really don't have much schedule of their own. They're on your schedule. It's when they get to be teenagers that I was often jealous of my husband. The kids rode to school with him and home again. By the time I got home, they'd already talked out everything that happened at school. They weren't real interested in sharing much more with me. When the kids were teenagers is when I suddenly had to have more control over my schedule so I could go to the football game and the dance concert and the piano recital, and at a time that they wanted you to be there. And when they said, Mom, I want to talk, you could say, okay, I'll give you a few minutes to talk. Because coming back to them at 10 o'clock that night, and they'd say, don't worry, it's done, it's over. And so I think a part of it is we need to mentor women about how you can have both a family and a very demanding profession. But it is, in fact, a very demanding profession. It's not something you do in your spare time.
Yeah, absolutely. Absolutely. That was wonderful advice. And that was the last of my questions. So before I let you go, is there anything else you want to say just to women in the field or anybody in the field or in general,
Well, I think at a time when medicine seems to be meeting so many challenges, obviously the pandemic has caused all of us to look at what we're doing, particularly to the degree that maybe, are we presenting in kind of a risk to our families? I think we need to think many times, not once or twice, but many times before we enter the profession of medicine. I can't think of a more rewarding and exciting place to be. I have had 4 or 5 careers over my my time in medicine, all with the original training that I got in medical school and residency. So there's plenty of room to spend 40 or 50 or 60 years doing different aspects of medicine. I'm not sure you can say that about a lot of fields. I think that a lot of fields might get a little tedious over time. But I think you have to go into it. I think you have to go into it realizing it's also a very demanding mistress. You have to stay up with the science of whichever part of medicine you're practicing. You have to stay up with the regulations and the rules, whether it's insurance companies or the government. They change every day. Now, you don't have to be engaged in trying to change those like I was, but you do have to at least find a mechanism, whether it's your state medical association or whatever, that will digest that and tell you what's changing, how those rules will impact you, and what things you now have to do. And then because it's very expensive to acquire the education, I think, hopefully people are doing this with the intent of a lifetime of service. It's interesting. We talk a great deal about choices that students make because they're frequently in substantial debt when they finish medical school. They've paid for college and medical school. But what a lot of people don't realize, at least in state-supported medical schools, is those students are actually into the taxpayers for a ton of money. Here in Texas, the state legislature provides close to $250,000 per student by the time they finish their training. And because residency programs are almost all supported by Medicare, it's a fluke of where it came from, but when you finish your specialty training, whether that's 3 years in family medicine or 8 years in neurosurgery, you're into the federal taxpayer dollar for $500,000 or more in money. So if you're going to spend $750,000 of tax, with whatever amount of your money you put into it, then I think this should be usually a career of a lifetime. Not that you have to do the same thing. Heaven knows I didn't. I did 17 years of private practice. I did 10 years, 12 years of academic administration. I'm now doing research and teaching. There are lots of ways to take that education and continue to give back. But a lot of people have invested in you to become a physician. It's important that it's not a passing interest.
Right. Absolutely.
So I can't imagine doing anything different than I did. It's been a fun ride, and it's not over yet. So, just keep going.
I love that. Thank you so much for taking the time to talk to me today.
You're very welcome. Thanks for asking.